With that, I think we are ready to get started. I'm going to go ahead and welcome Patricia Rice, who's the host of this event. She's our social media director. So go ahead and get us started, Patricia.
Hi, hi and welcome. My name is Patricia Rice, social media director for the Colorado Foundation for Universal Healthcare. Before we begin, if you like these kind of programs, please consider donating to the foundation. You can either donate to our Facebook page or our websites. Links for those two pages are in the chat section of Zoom. We are a nonprofit and exist solely because of your donations. I am so pleased today to be talking with Laura Katz Olson, author of the book, Ethically Challenged, Private Equity Storms U.S. Healthcare. She's a distinguished professor of political science at Lehigh University in Pennsylvania, and also the author of Elder Care, A View from the Front Lines, and The Politics of Medicaid. One of the many things that I found enlightening in her book is that the same thing that's happening to U.S. healthcare is also what happened to Payless Shoe Source and Toys R Us. They were both bought by private equity groups. Personally, my personal experience is that I love Payless shoes, decent shoes at an inexpensive price. One day I walked into a Payless, and this was a few years ago, to find that the price of a pair of shoes that should have been $15 or $20 was $40. And I was confused as to why that kind of a jump took place. Both of these iconic businesses, Payless and Toys R Us, went bankrupt. Laura is going to give you a 25-minute presentation to talk about what private equity is, what these groups are doing in healthcare, and how it affects both the quality and the cost of healthcare. After the talk, we will open it up to questions. You can put your questions in the chat or raise your Zoom hand. To raise your Zoom hand, go to the bottom of your page and you will see the term reaction as one of the options. Click on reactions and an option to raise your hand will appear. Click on that and a little hand will appear near your picture on Zoom. Laura, welcome. We are so excited to have you here. And she's going to give you a presentation, so get ready.
Hi, I'm so glad to be here and thank you everybody for attending. Let me just see if I can put my slideshow. There it is. Okay. I think we lost me. Okay. Private equity firms have taken over all aspects of our lives. They have their claws everywhere, from what we drink, Dr. Pepper, where we sleep, Motel 6, how we communicate, Skype, where we obtain our office supplies, Staples, the way we power our electronic gadgets, Duracell batteries, how we have done almost everything in our lives. Now, with the voracious appetite, PE is encroaching on our healthcare, our health, our well-being, and even our dying. If you are addicted to opioids, do not be surprised if the PE is your treatment center or its helicopters are swooping down to your crash site to take you to the hospital. Private equity could be your dermatologist, your dentist, your ophthalmologist, or your enterologist. You may be at the mercy of private equity in hospital emergency rooms or in dialysis centers if your kidney is damaged. Right now, private equity owns $6.5 trillion in assets in the United States and has control over 12 million American workers. My interest in healthcare began nearly 50 years ago, especially my interest in long-term care, elder care, and the aging policies of America. More recently, I started noticing that private equity, whatever that was, started cropping up. I had no idea what it was. I learned later on, after I completed a significant amount of research, that private equity has what I call a penchant for secrecy. They are not accountable to anyone. And I'll give you just a short story. I've attended a number of private equity conferences. And at one conference, they mentioned in the beginning and at every single session that whatever is said at this conference should not be shared with anybody else. And at some places, they mentioned it twice. Now, my father once told me, if more than one person knows a secret, it's not a secret anymore. And I looked around me and there were 350 people there. So it's hard for at least that part to be kept secret. But they don't have to give the vast majority of their doings, not even to the SEC, where public companies have to give minute details. What's also interesting to me is that in healthcare that is controlled by private equity, there is a huge money flow, most of it, if not all of it in some cases, coming from the taxpayers through Medicare and Medicaid. Private equity has been in healthcare for a while, but it started to grow extraordinarily in 2015. And I think it's important to understand that the full damage of private equity will not be known for many years because it's just beginning to take over our healthcare structure in the United States. What I think is important, and one of the things I want to do in this presentation, as challenging as it is give you an idea of the playbook for private equity, how it works. Because in my opinion, if you understand how it works, you can then understand the inevitable damages that it does and will do to our healthcare system. So, the first thing that I think is important is that, I don't think I'm going to go back. The first thing that's important is that profit, not just profit, but extraordinary, oversized profits are the main goal of private equity. Now, we live in a capitalist society and profits are considered normal, and we all support that certain enterprises, private enterprises need to have profit, of course. But for private equity, it has to be supersized profits. And the reason being is that their investors would not invest in them. They would go into the public markets because private equity is more extreme in terms of its danger than the public markets. So its investors expect supersized profits. The second thing that I think is really important is that private equity does not care what their product or service is. It could be Roto-Rooter, or it could be hospice. What's important to them is to go where the money is. Like Willie Sutton said, when people asked him why he robbed banks, he said, because that's where the money is. And that's what private equity is all about. They also don't care about the long-term growth of a company because they have to sell it in under 6 years. 6 years or under. And in healthcare, as I've been watching, it's been more like 3 or 4 years. Okay, so let me go now explain how it works. It's very, very complex, and I've tried to simplify it. Okay, it first begins with a private equity firm raising money for its next fund. In this case, it's Fund 3. I've labeled this Fund 3. What they have to do is now raise money from limited partners. These limited partners are public pension funds, university endowments, and nonprofit endowments, and now sometimes wealthy families. Now, just as an aside, in Colorado, you have the Public Employees Retirement Association, which covers Denver public schools, state employees, and some state subdivisions. There are 660,000 current and future employees in the Colorado Fund, and their total is $66.1 billion in assets. 8.5% or $5.6 billion of the Colorado money goes to private equity, just so you understand who the limited partners are. Okay. The private equity firm has 6 years to deploy the money. And the way they do it is they acquire stakes in businesses. So each fund usually has about 10 to 15 businesses, which then become part of the fund's portfolio. So Fund 3 will get $10 to $15 billion taken from the public pension funds, including Colorado, and buy these businesses. The PE firm only puts in 2 to 3% of the capital. So they're only putting in a fraction of the money. So they get the pool of money from the limited partners, they put in usually 2%, and then they borrow the rest, usually between 60 and 70%. There are 4 main targets, and they call them targets, for the businesses that they buy. One is public companies that they take private. The second is another private company. They might merge with them. The third is a division of another private company, which they call carve-outs. And finally, more recently, and this has been more and more the case, they have been buying from each other in secondary leverage buyouts, in tertiary leverage buyouts. In retail, they've gone for 4th and 5. They haven't reached that many yet in most healthcare, but they're certainly going to head that way. The companies are bought through leveraged buyouts, which means there's going to be huge debt. The company can be used as collateral for these debts. Some of it is junk rated, which means high interest rates. But most of the debt is through banks, although I have just read recently that the banks are not giving them money right now, and they're getting most of their money through other private equity companies that have debt to give out. They call them private debt funds. So one private equity company may borrow funds from another private equity company. And that's right now because the banks are reluctant. One of the things that I've read, though, is that when they borrow money from these private equity companies, they're usually covenant light. What that means is there aren't a lot of restrictions, which makes it easier to go into bankruptcy, by the way. Okay, now this is the most important point. The trick is that the private equity company does not pay back the debt. The debt is paid back by the company they bought. So if you buy Toys R Us, for example, and you buy it with 60% debt, Toys R Us is paying back the debt, not the private equity firm. So let me give you an example. If a company is bought for $100 million, the private equity firm will put in $2 million, or 2%. The LPs, such as the Colorado fund, will put in $38 million, or 38%. The debt would be $60 million, or 60%. Even if the initial company sells in 5 years for that same price, which of course it doesn't, because they want to increase the value, the total equity in the company, which is serviced by the company, would be $100 million. Okay. The first thing a private equity fund does after it buys a company is get it ready for sale. Okay, the first thing a private equity does when it buys a company is they get it ready for sale. And they do this through two main means. One is maximizing revenues of the company so they can pay back the debt. And the second is acquiring additional businesses. So let's start with the maximizing revenues. How do you maximize revenues? How do you get more money out of a company? Private equities will tell you that they become more efficient. But the one thing I want to tell you is private equity only buys flourishing companies. I remember when Mitt Romney was running for president, and he said, oh, we help distressed companies get back together. That's just not the case. They buy functioning companies. Distressed companies can pay back a debt. Although I will say there's some private equity funds, a few that specialize in distressed companies, but just a few. Okay, so how do you get more revenue out of a company? And I'd like to give you a list that I have right here. They cut less profitable services. Some of them, like in a hospital, may be vital. One hospital cut emergency care. So some of these may be vital services that are just not as profitable. They add profitable services. So a dermatology place might add more cosmetic surgery. They limit technical innovations, modernization of equipment, and R&D. There's no point, they're going to be selling it. So why invest a lot of money in the company? They streamline personnel. So you have fewer people to take care of the patients. You use lower paid, less qualified workers, for example, medical assistants instead of physicians. And in the cases of other healthcare, they use less skilled workers to do skilled work. They lower wages and slash benefits. That, of course, is a good way to make money. They intensify workloads. For example, they may have 10 patients per provider, as opposed to the previous 5. They limit training. So what you find is a lot of people, for example, in rehab are not trained for rehab. They have less supervision, so a lot of these untrained workers are on their own, which leads to, of course, disastrous effects. They use cheaper materials. I'll just give you one example that I saw when my mother was in a nursing home. They used cheap diapers. And as a result, there was urine all over the place because they leaked. Not my mother, but everybody. When she went to a better nursing home, they used better material, and there wasn't that leakage. They limit supplies. I've noticed when I've looked at ground ambulances, many of them owned by private equity did not have sufficient supplies. They upcode insurance so they can get the most out of Medicare and Medicaid. They give hard sell of their products or procedures, trying to convince people to get procedures that they may not need. And they also can use hardline billing. I noticed that some practices before private equity would kind of let people pay it off, or they'd let people, give them less, a lower cost for their service. But as soon as private equity took over, that was the end of that. So the second thing that they do in order to pay off their debt is they increase the value of their enterprise. And what that means is they do add-ons and mergers. These two, of course, are done through debt. What they'll do is take smaller practices or smaller agencies, some of them mom and pop shops, and they will add them to the main initial company that they bought. And that company is essentially called the sorry, I don't have my glasses on. And this is called the platform company. And they'll take this platform and add more and more businesses. Each add-on increases the value of the company exponentially. And if you have enough add-ons, your value of your company can increase. In addition, and this gets to the price, when you buy and add more companies, the aim is to get to a local, regional, and sometimes national monopoly. And in that way, they can control prices and raise costs. And I think that's similar to what you were talking about, Patricia, in your introduction at Payless Shoes. Okay, the private equity company can also build, add de novo companies, that's what they call them. In other words, build new companies to get more patients and more revenues. Now, the private equity industry will argue that they are actually doing a service because they are giving areas more services, especially in underserved areas, that they don't have already. For example, there's a shortage of autism services and they're adding autism services. The problem is that these de novo or new companies that they build have the same playbook as private equity. And that means their idea is to maximize revenues, and therefore the quality of these new enterprises tends to be very low. So that's a big problem. Then they get to their main job, and that's to exit. They sell the company, as I said earlier, usually within 6 years. And the idea is to sell the company at a higher valuation than they bought it. So let's get back to that $100 million company. Let's say they sell it for $200 million. They will now have $200 million in equity because the company has paid back the debt. And what that means is that the equity in the company for the private equity firm and its investors has increased 5-fold. Now, how does private equity make its money? The bread and butter of the private equity firms are carried interest. What that means is that they get 20% of the sale price. Now, bear in mind that they only put in 2%, but they're getting back 20% of a higher value. So that $200 million company, they're going to get 20% of that. it is also taxed at the lower corporate rate rather than the individual rate that the rest of us pay when we get income. Now, this is important because the last piece of legislation passed under the Biden administration had a piece to get rid of the carried interest. And through incredible amounts of lobbying, of course, at the last moment, they kept the carried interest outside of the legislation. So it's still in effect right now, despite everybody knowing it's an unfair tax advantage. They also get huge millions of dollars through management fees, which is 2% of the sale price annually. So every year they hold a company, the LPs, your Colorado, the percentage that your Colorado pension holds is paying them 2% of what they paid for the company. And that, of course, adds up to millions of dollars. And the higher the price of the companies they buy, the more they get. There are also transaction fees, the buying and selling of businesses, monitoring this, legal fees, etc., that the companies themselves pay. Even more egregious is their dividend recaps. Every once in a while, and sometimes more than once in a while, the company will take a dividend for themselves. In other words, they will take money out of the company, put it in their pockets, sharing it with the LPs, using debt on the company, which again has to repay it. Another egregious thing that they do is they can sell, and this is true of Toys R Us, but it's usually mostly true of hospitals and nursing homes. They sell the retail property of the company or the chain that they buy. And then that chain, that nursing home, Toys R Us, whatever, has to pay rent on the property they used to own. And that, when they sell the retail property for millions of dollars, that too, they pocket. Finally, interest on all of their debt is tax deductible. And of course, that gives huge amounts of profits for these companies that they own. These debt burdens can be disastrous. They put huge numbers of their companies in financial stress and sometimes bankruptcy. In recent years, there have been many high-profile bankruptcies, including Toys R Us, including Payless, which Patricia talked about. You have Necco, Claire's, David's Bridal, Jamboree, Bumblebee, Radio Shack, Staples, Sports Authority, The Limited, J. Crew, Guitar Center, and Art Van Furniture. Just yesterday, I read that Party City, the discount party supply, went into bankruptcy, and they are private equity owned. The question that I have is, can we afford this in healthcare? The loss of Toys R Us was disastrous. I know it was disastrous for my daughter, but it was disastrous for communities. It was disastrous for parents. It was disastrous for the workers. But that is nothing compared to a dialysis center going bankrupt and those patients having nowhere to go, having a cancer center go bankrupt, and having people under cancer treatment having nowhere to go. So healthcare is different than all of the rest. We have not seen many bankruptcies yet in healthcare because it's so new, but we have seen some. For example, U.S. Dermatology Partners, which is the third largest dermatology chain in the United States. They have 50 offices in 20 states. They went through 3 private equity buyouts since 2013 and went into bankruptcy in 2020. In only 7 years, they were bought by 3 private equity firms in turn and then went into bankruptcy. We've had earlier bankruptcies in dental care, for example, All Smiles Dental Center and Small Smiles. We've also had bankruptcies in ophthalmology practices in the 1990s. It is just, if you know the private equity playbook, many more bankruptcies are to come. The evidence suggests, from everything I've seen, that the private equity firm does not pay any consequences of real when one of their companies goes bankrupt, and in some cases they get sound profits. Because remember, before it goes bankrupt, they're taking money out in dividends, they're taking money out in management fees, and so on. So Bain, for example, did not have any consequences of that were important when Toys R Us went bankrupt, for example. So why a private equity in healthcare? First of all, there's a huge and growing amount of dry powder. Now, dry powder, there's $2.3 trillion in dry powder. Dry powder is the amount of money committed by the pension funds, but not yet deployed. So they have $2.3 trillion at their disposal that they can go out and buy new chains, new companies, etc. There's also an ongoing and increased federal and state revenues through Medicare and Medicaid. Medicare is 14% of the US budget. Medicaid is 9.7%. And for almost every single state, it's 20% of their budget. So there's plenty of money there through the federal government that's going to be there for them, just continuous flow. Of course, you have the aging of the population, which means that there's a need for more treatments and there's a need for more drugs. So that adds to the demand. Private equity likes fragmented industries because then they can do the add-ons that they want. Oh, yes, and healthcare is recession-proof. You often don't have a choice whether you're going to have need health, whether you're going to get your health care. If you have kidney disease, you need dialysis. You can't say, no, I'm going to give that up. So that's another reason. Also, health spending is nearly 20% of our GDP. There's also limited regulations in many of our sub areas, which is, of course, a delight to private equity. For example, in autism, in eating disorders, in alcohol and drug rehab, there's no really set procedures and rules and regulations that the government has. And finally, and just as importantly, government policies themselves have fed the private equity enterprise. For example, the federal government, in its desire to save money, although it doesn't, has tried to move people from nursing homes to home care. And as that built the momentum, private equity jumped into home care. There has been an increased diagnosis for autism and funding. There's increased government funding for opioid treatments. The ACA, the Affordable Care Act, of course, made more people able to spend money on healthcare. And each time the government has done something to open the spigot, the private equity firms have jumped right in. So I'd like to give you 2 examples of disastrous PE holdings in healthcare. The first is Prospect Medical Holdings. It is a chain of 17 hospitals in 5 states that serve low-income communities. It was bought by Leonard Green, a private equity firm, in 2010 for $363 million. By 2020, Leonard Green took $645 million in dividends out of the company. That's 3 times its acquisition cost. Then they took another $100 million in fees. And by the way, nearly 80% of the money that went into Prospect Medical Holdings comes from Medicare and Medicaid. Because they have put such debt on the company, the Prospect Medical was experiencing supply shortages, broken elevators, dirty surgical care, mold, bed bugs, water leaks, ambulances regularly breaking down, staffing shortages, improper charges and bogus claims, and unnecessary admissions. In 2019, Green sold the land and the buildings, then making the hospital pay the rent on top of the high interest. As you can imagine, some of the hospitals have had to close. Remember, these are safety net hospitals for low-income communities. And then in 2021, 2 years ago, or 1 year ago, Leonard Green sold it without any repercussions. And when they sold it, it had a $1.3 billion debt on it.
Oh, God.
Okay. Just one other example. This is one of my favorite places. I don't know how many of you have ever, I'm sure you've heard of it. I don't know if you've been there. And that's the PE-owned dental chain, Aspen Dental Management. In 2022, it was the largest dental service company in the United States with over 1,000 locations in 46 states and 15,000 employees. It was first sold to the PE by its founder in 1997 and was flipped 5 times. In other words, it was sold to 5 different private equity firms over the years. In 2010, it was sold to Leonard Green and Partners. Aspen has had egregious practices since the private equity took over, and they've been sued multiple times by states. The last suit was by Massachusetts last year. What they do is they have bait and switch. They'll advertise free services and then charge the patients. They do avoidable and excessive treatments. One employee described the initial dental exam as a sales tactic to maximize revenue on every new patient. They have unclear terms for financing, and it's been really disastrous for low-income patients. They have bonus programs that set goals for the dentists and their office managers to profiteer. And they have high pressure tactics to develop treatment plans for unnecessary, expensive procedures. One dentist said, "I left because I couldn't do it anymore. the company spends most of its time trying to talk people out of their teeth. Private equities have taken 1.5 billion in debt dividends from Aspen since 2006. Okay, I'm going to conclude. My first and main conclusion is that private equity should not be in healthcare, period. My second is that we need to enforce the prohibition of corporate practice of medicine. What we have is financiers controlling our medical care. There's now this very interesting suit in California by a bunch of emergency doctors. They are not asking for any money. All they're asking is that the court stop the corporate practice of medicine. Third, we need to eliminate the tax advantages that the private equities have, such as the deductibility of interest on debt, the carried interest, taxes, capital gains, etc. Fourth, we have to limit the amount of debt companies should be allowed, especially in healthcare. And finally, we need severe controls on the consolidation and monopolization that's going on in the healthcare field. Thank you.
Wow. Laura,
Thank you,
that-
Laura, that
oh.
was amazing. Yeah, would you,
really is amazing.
Oh, let me see if I know how to get rid of this. Oh, here.
Okay.
Stop
all right.
share. There we go.
All right, thanks. Thank you so much, Laura. That was that's devastating for so many people. A couple of things I wanted to add to your presentation is one of the things that, as I was reading your book, it talked about dermatologists and having the physicians replaced by, let me see, physician assistants. And one in several cases, apparently, they misdiagnosed skin cancer as eczema.
Mm-hmm.
And then the other thing that's even more shocking to me is that during the pandemic, the private equity-owned nursing home facilities experienced a 10 to 20% higher death rate than other nursing homes. So private equity-owned healthcare facilities is something that we really should not tolerate. I agree with you. Sarah, do you want to take it over with questions?
sure. Let me just remove your spotlight so you're not on the spot there.
Thank you.
So I see some hands up and there were a couple comments in the chat. So I'm gonna start with the chat and then I will come to the people who have their Zoom hands up. Thank you so much. Robert Messman made the comment that advanced dermatology is controlled by private equity and that they use cheap needles which could break in use. They brought testing in-house so they could claim more biopsies were cancerous, driving up the treatments. And then Richard says, I would prefer not to patronize any healthcare provider owned by public equity. So how do I find out who that is? So that's a really good question. Do you have an answer for that, Laura?
Yeah, that's a very, very good question. I had something on my skin and I needed to go to a dermatologist and I made an appointment. It's very hard to get an appointment with a dermatologist. And I made an appointment and then I went to bed and in the middle of the night, I woke up with a start. Oh my God, that's a private equity owned dermatologist. And I immediately canceled. Private equity does not label themselves private equity. It does not say private equity owned Aspen Dental. It is extremely difficult to know whether it's private equity owned. And that's this whole idea of their secrecy. In many cases, for example, nursing homes or even other places, of course, they label each of their individual agencies or companies with different names. Like you'd be going to Evergreen Nursing Home or Bright Springs Nursing Home, and you will never know it's part of a chain owned by private equity. It is extremely difficult. I find that even when I ask, I'll go to a physician's office and say, who owns this? Is it private equity? The workers don't know, or many of them don't know. So it's a great question, and the answer is it's very difficult to find out.
Thank you, Laura. And before I unspotlight you, or I might just keep you spotlighted since many of these are for you, but Laura H says to everyone that I am one with skin cancer misdiagnosed as eczema in a corporate-owned practice. So, Laura, we're glad you're still with us.
Yes.
We have somebody else asking, is Private Teeth owned by, sorry, Perfect Teeth owned by private equity? Do you happen to know the answer to that one?
I don't know, but the name is not one I've become familiar with.
Okay.
I'd like to add to the dermatology issue, not only do they misdiagnose, but they often, I've seen many cases in studies that they will take something that's benign and they know is benign and say, we gotta, dig it out and check it for cancer because they'll make more money that way. So they don't only make mistakes, but they also over-diagnose.
Thank you. Okay, so and I apologize, I couldn't see who raised their hand first, but I see 3 hands that are raised. I'm going to start with Marjorie Allison, and I'll lower your hand, and then
Okay.
yeah, you're not muted, are you, Marjorie?
No, I'm not.
Okay.
Can you hear me? Okay,
Yes.
great.
Yeah.
My question is, these are very compelling facts that we've got here. Who is working on remedying this situation? I mean, we're a great example of heightened awareness now. Are there any groups that are like, this is our thing, to do the things that Laura Olson and others have said need to be done to remedy the situation?
Yeah, there are several groups actually that I'm working with. We meet with representatives from these groups once a month, and they're working really hard. The federal government, of course, which is something I did not get into, but some, I think is really important. A lot of federal officials go into private equity when they finish, or they come from private equity. I just learned that, what's his name? Jeffrey Ziento, Biden's new chief of staff, comes from private equity. So it's not just the lobbying, but it's also they're entrenched in the private equity field. So, but there are some advocacy groups, very few. And there is some people like Bernie Sanders and the Stop Wall Street Pillage Act, I think that's what it's called. But it's gone nowhere. Remember, they really control, the private equity really controls the political space, not just through lobbying, but by entrenching themselves in the industry.
This would make a fantastic documentary.
Agreed.
Yeah.
So I'm going to call next on Maddie Jacobs and ask you to unmute yourself and try to share the spotlight if I can while you ask your question.
Hi, Maddie.
Hi. Yeah, I don't have my video on because of my rural internet. I'll try to have it on for this question, but I just think that, thank you for your presentation,
Yes.
Laura. Unfortunately, none of this is news to me nor anyone else in the foundation. And the way I see it is that private equity is the nth degree of the corporatization of medicine. That, you know, some of these corporate hospitals that are being taken over by private equity and these other chains that are being taken over, their goal is profit, not healthcare. And that, you know, that is the big picture that we need to be looking at here and bringing to people's attention. So I just kind of wanted to make that comment. And as far as what people are doing, obviously the foundation is an advocacy group because we're trying to get rid of the profit motive in our healthcare system. So just wanted to make that comment, and thanks again for your presentation.
Yeah, I agree with you. You know, something like 60% of all physicians now are employees. And certainly you have these hospitals that are consolidating everything. And where I live in the Lehigh Valley, we only have 2 main hospitals that own everything, doctors, practices, etc. The difference, in my view, is that profits is not their only goal. And second, that at least you have medical personnel on the board of directors taking charge rather than financiers. Maybe the results are the same. So I think what's happening in healthcare, you're right. It's not just private equity. Private equity is really financialization on steroids.
Thank you. So I'm going to call on Les Reitman, who is also, along with Maddie, part of our medical professionals for Universal Healthcare Group. Les, I'm asking you to unmute before you talk. Yeah. I think you're still muted. And then I will get to the chat because I see several new comments, questions coming in.
So my question is, who is the most effective whistleblower for this practice now? I know that, you know, some law firms with the PNHP have been responsible for slowing down REACH or got it changed over to REACH. But this is a war. This is like we need the Leopard tanks from Germany over here in law firms who can, because Biden is making money on this. Somebody in the big is making lots of money. We need, you know, we need somebody who is able to really threaten legally high-powered people. And that means we need all of Germany's Leopard tanks, because this is, you know, the ultimate corruption. Because it's one thing if you pay more for a pair of shoes, but it's another thing when you have no idea how much you're paying except your life. And we need story after story after story.
Mhm.
Stories is what moves legislators, not law firms and papers and letters. So who is going to be the best way to approach this situation? Who's going to be the best whistleblower?
Well, right now, there's a huge increase in journalists, reporters, reporting on not the larger issues, but taking stories of people who have been hurt by private equity. And these stories, you know, unfortunately just get lost. I've collected them, but they get lost. But you know, it's very hard to be a whistleblower because people who sell their private equity firm, who sell their company to private equity, they have to sign non-disclosure, non-disparagement clauses. When I tried to, you know, for my book, I tried to interview a lot of, you know, people who had sold their practices to private equity. Very few would talk to me because of these non-disclosure, non-disparagement clauses that they have signed. And they were afraid of, you know, the repercussions. And that keeps the secrecy as well.
Thank you, Laura. We're gonna there's a lot of comments and questions, so sorry about not allowing the follow-up last. I apologize. So we have a comment in the chat from Erica Pike saying, yes to connect to the who's doing the work question. I have been impressed with the Institute for Local Self-Reliance. Also, I heard enforcing corporate practice of medicine laws as a clear action step. And do you know of any state policy examples that you think are on the right track?
I don't, I wrote this down the other day and I don't remember, but there's a number of states that have, you know, at least some prohibition to the corporate practice of medicine. And I think there's at least 3 states with strong prohibitions. As I said, I know one of them is California. And they're being sued. And I think I haven't really followed this as closely as I would like. But there's a number of suits coming up that are suing the state for not enforcing the corporate practice of medicine prohibition. And I think that would, if they win in California, and the lawyer there seems pretty dedicated, I spoke to him, that could be a really important dent into at least private equity in healthcare practices and physician practices.
Thank you, Laura. So our event technically ends at 2, but we thought we would take questions for a little bit after the hour. If anyone needs to go, we respect your time.
Yeah.
We will wrap up entirely by at the very latest in 10, 15 more minutes, if that's okay with you, Laura.
Sure.
It may be sooner. I'm just letting people know. And then basically a couple more questions in the chat from Virginia. This is actually more of a statement that Kirsten Cinema is Exhibit A in doing the bidding of private equity. I expect she'll be taken care of by them when she's finally defeated at the ballot box. Bob Wolfson recommends the Healthcare Divide documentary on PBS, and there's a link in the chat. Elaine wonders if John Oliver, we love when he takes on a subject, has talked about this. And then I'm seeing a raised hand by Don Parsons. I am gonna I was gonna spotlight you if you want to share your video, but Don, but you don't have to. You could also just speak your question, would be fine.
Yeah, thanks. I apologize for my video. It keeps breaking up. For context, I'm a retired doctor. Spent my 40-year career with Kaiser Permanente, where the doctors, the Permanente part of that organization, actually control the practice. So it's not corporate practice of medicine. Those of you from California and elsewhere know. I refer to the hospital-based physicians as RAPE, radiologists, anesthesiologists, pathologists, and emergency physicians. It's an unflattering acronym, I admit. Maybe I should make it PAIR. In any case, throw in emergency or hospitalists as well. In the Denver area, in Colorado generally, and perhaps elsewhere, most of the formerly independent but substantially large groups of physicians representing these 4 disciplines have been taken over by private equity. It's convenient for them because they don't have to worry about billing, but it is enormously encroaching on their practice. And I would be very curious, Laura, thank you for your presentation. If your experience has, you mentioned emergency physicians, but how about these other hospital-based physicians? Have they also been a part of your study?
Yeah, those 4 that you talked about are often owned by private equity firms, and they've been at the center of controversy of surprise billing practices, whereas they don't contract with the with people's health insurance and then charge them enormous amounts of money, the private equity owned places. And That has been limited somewhat by the recent No Surprise bill, but it still goes on. So yes, those 4 hospital-based, especially the emergency room, but also anesthesiologists and the rest, have been captured by private equity for disastrous effects on price.
Thank you, Laura, so much. Is there, Bill, am I missing any hands up? Okay, all right. Well,
Do we have any on Facebook?
Don't see any
Okay,
any other new questions.
well, Laura, we all learned so much, and if you would like to learn more, please go ahead and pick up Laura's book, Ethically Challenged, Private Equity Storms U.S. Healthcare. I know Patricia's been talking with me as she reads the book a lot. It's very, very in-depth with a lot of data and a full education in private equity, which sounds like it would be empowering for people who care about healthcare for people. Patricia, do you want to say anything else before we wrap up?
I do. Somebody raised the question about what is there to back all of the things that Laura, back up the things that Laura had said. And I wanted to point out that there's 100 pages of notes and references at the end of her book, which shows to me an immense amount of research on this topic. Laura, I cannot thank you enough for coming here today and talking to all of us. It has been an eye-opener for me to listen to you and also to read your book.
Well, it's been my pleasure. Thank you.
You're welcome. Does anyone else have any more questions? Okay, then we'll wrap it up. Thank you. Thank you, everyone.
Thank you, Laura.